Doctors, we are live. You can start the session.
Okay. So, good evening, everyone, and a happy new year.
Good
Welcome
evening,
to
sir.
this All India Postgraduate Quiz, which is a big Q. So, this is Brain Teasers in association with Ophthalmological Society of Nagpur presents the big Q in its season 4. So, this is the
समंदर अपना अंबर
साला कुछ
खोज
जीतना
ले
ही
अब
नहीं
तू अपने दम पर
to
फूक
everyone
मार के
that
धूल झाड़ ले छोड़ छाड़ के सारे छप्पर हट समंदर अपना अंबर खोज ले अब तू अपने दम पर फूक मार के धूल झाड़ ले छोड़ छाड़ के सारे छप्पर खोल दे पर खोल दे पर खोल दे पर खोल दे पर बंद घड़ी की भी रुकी हुई सुई होती सही दो दफा चुप क्यों है रहना मन का तू कहना रोके चाहे हिचकियां खोल पर खोल पर खोल पर
yeah, 1 minute. 1 minute. Yeah. So, good evening, friends, and my pranam to all the mentors. The Brain Teaser teams welcomes you all to this inaugural episode of this 4th season of Big Q. Well, to the newcomers, Brain Teaser is an online platform for hosting quizzes for all ophthalmologists of our country, which has been in vogue since last 6 years. It was 3 years back for the first time in our country, we initiated an exclusive quiz for postgraduates with the aim of getting all postgraduates from across the country on a single platform. There are approximately 320 institutions offering post-graduation in ophthalmology, be it MS or DNB. The very first season was done in association with Bombay Ophthalmological Society, and we had a participation of 200 plus teams. The last 2 seasons we have done in association with Ophthalmological Society of Nagpur, and fortunately for us, the popularity is growing, and last year we had the record breaking of more than 600 plus teams enrolling for this particular event. So here we are back with the 4th season. And again, let me take this opportunity to thank Ophthalmological Society of Nagpur, the president, Dr. Krishna Bejwani, for associating with Big Q in this season as well. Postgraduates, this is the 4th season, which has 6 preliminary rounds, 4 quarterfinals, 2 semi-final, and there would be 1 final. So in general, there will be about 13 episodes, which would be aired on alternate Wednesdays at 7:30 p.m. Brain Teaser is extremely thankful to the team of quiz masters who toil hard to create wonderful experience of learning with fun, of course, for you all. Today's episode, we have some new quiz masters along with few who have been associated with us in last few seasons. We welcome Dr. Vijay Bhaskar, who is currently in charge of Community Ophthalmology Department at Shankara Eye Hospital, Guntur. The second quiz master is Dr. S. Venipriya, who is an associate professor at Department of Ophthalmology, Pondicherry. And the third quiz master is going to be Dr. Tamonash Basu, who is a consultant at Netralayam Super Speciality Eye Care Center, Kolkata. Money maketh mayor go is an old saying. Such mega projects are not possible without a strong financial partner. And this time we are lucky to have His Highness as our partner. My sincere most gratitude goes to Mr. Suryanarayan and other team members, Mr. Kaustubh from our region, for their support and pushing us to start this season. Of course, I would fail in my duties if I don't acknowledge the field force of His Highness, who made so much of effort to enroll all the postgraduates from across the country. Smooth and flawless execution of this Brain Teaser platform, which is an online event, all registrations, live quizzing, computing results, and other backend work goes seamlessly because of the team of Numerotech headed by Mr. Sai. I'm sincerely thankful to the whole team. So now, without much ado, can I request my co-quiz master, co-host, Dr. Shilpi Narnore to familiarize all the participants with the rules of the game. Over to you, Dr. Shilpi, please.
Thank you, sir. So welcome back, all the postgraduates and all my friends. So quickly, we will go through to the rules. So this is season 4, which will be aired alternate Wednesdays at 7:30 p.m. So platform is Kahoot for both the teams and the private practitioners. So there will be total of the 13 episodes. So 6 preliminary rounds, 4 quarterfinals, 2 semifinals, and 1 final. So these are our today's quiz masters. So the format is, in preliminary rounds, there will be 6 sets. So total of the best 4 performances will be calculated so that you can qualify for the quarterfinals. So if by any chance you miss any round, don't worry. Out of the 6 rounds, we will take the marks of the best 4 performances. So every team needs to log in into 2 devices. First is the Kahoot first is the screen is the live quizzing, which will happen on the Zoom platform. To monitor the teams, your videos should be on, but audio should be off. And the second screen is the Kahoot to answer the questions. So there are 6 sets of MCQs, 2 sets of unscramble the word, and 1 set of one-word answer. So each set will have 5 questions. You will get 10 seconds per question to answer, and there is no negative marking. So these are the prizes for the finalists. Mentors to log in from the different screen. And these are the audience prizes per episode. So now let's quickly see what is how to play so that you can check whether your Kahoot is working or not. So which hockey player is conferred the prestigious Padma Shri award? Your options are A. Harbinder Singh, B. Bholanath Singh, C. Padma Dilip Terke, and D. Vivek Prasad. And your time starts now. Just remember, you have to just press the answer after the timer starts. So the answer for this question is Harbinder Singh. With this, I welcome our first quiz master, Dr. Vijay Bhaskar, who is in charge of the Community Ophthalmology Department at Sankara Eye Hospital, Guntur. He is quality champion at Sankara Eye Hospital and is responsible for leading quality improvement initiatives within the hospital. He manages the rotations, academic activities, and training programs of more than 40 DNB students and fellows. With this, I hand over the screen to Dr. Vijay.
Thank you, Dr. Shilpi. And before starting this, I would like to thank Dr. Prashant sir and BQ team for giving this opportunity. So without any delay, let's get into the quiz proper. The first question is, which of the following is usually not associated with pediatric cataracts? I repeat, not associated with pediatric cataracts. And your options are option A, galactosemia, option B, aminoaciduria, option C, glycogen storage diseases, option D, maternal rubella infection. And your time starts now. And the answer is glycogen storage diseases. The all other options like galactosemia, aminoaciduria in condition like Loeys disease and maternal rubella infection associated with the congenital cataracts except glycogen storage disease. Let's enter into the question number 2.
Sir? Dr. Vijay?
Yeah.
Yes.
Question number 2. Which is a false statement regarding protein and protein breakdown in the lens? This is a false statement. And your options are option A, protein accounts for 33% of the lens weight. Option B, crystallines account for 90% of lens proteins. Option C, active proteolysis occurs throughout the lens. And option D, calpain 2 degrades alpha and beta crystallines. And your time starts now. And the answer is active proteolysis occurs throughout the lens is a false statement. The protein synthesis occurs only in the peripheral lens cells, and active proteolysis is not a feature of lens fiber cells, although it occurs only in peripheral cells. Now let's enter into the question number 3. Which statement is true? I want true statement. Options are A, the lens will opacify if deprived of oxygen. Option B, the lens will opacify if deprived of glucose. Option C, the lens mostly relies on aerobic glycolysis to generate ATP. And option D, alpha crystallines are the most abundant of lens crystallines. And your time starts now. And the answer is the lens will opacify if deprived of glucose. The reason is the lens can function without oxygen but not with glucose. So it is a glucose dependent in a glucose depleted environment. The lens will become hazy after several hours. Alpha crystallines are largest and beta crystallines are the most abundant of lens proteins, not alpha. And the question number 4. Polyopia is a symptom of option A, the cortical cataract. Option B, posterior polar cataract. Option C, radiation cataract. And option D, cupuliform cataract. Your time starts now. The answer is option A, cortical cataract. The all other things will not cause any polyopia or diplopia except the cortical cataract. Sometimes the nuclear cataract also can lead to monoocular polyopia. Let's enter to the 5th question. What complication is common in cataract surgery in a patient with nanophthalmus? And your options are option A, endophthalmitis. Option B, irregular astigmatism. Option C, fragmentogenous retinal detachment. Option D, uveal effusion. Your time starts now. And your answer is option D, uveal effusion. In nanophthalmus, it is a short axial length eyeballs. The ratio of lens volume to eye volume is higher than normal because of anterior chamber crowding and thickened sclera posteriorly, which impairs venous drainage through vortex veins. It causes uveal effusion. These are the first set of 5 questions. Now, let me introduce Dr. S. Veni Priya, who is Associate Professor in Department of Ophthalmology in Pondicherry. And she's having 14 years of teaching experience in various medical colleges. She's executive member of POA, member of TNOA, AOS, and POA. She presented papers in state and national conference. She won the best paper in orbit and oculoplasty in TNOA 2023 and having publication in national and international journals. So over to you, Dr. Veni Priya.
Thank you, Dr. Vijay Bhaskar. Good evening to all. We will move on to the next session of MCQs. Question number 1. The prevalence of visually significant nuclear sclerosis in post-vitrectomy patients is option A, 20 to 25%, option B, 40 to 50%, option C, 70 to 80%, option D, 80 to 100%. Your time starts now. And the answer is 80 to 100%. Almost all the patients will develop nuclear sclerosis. Why? Because the nucleus is totally dependent upon the vitreous and aqueous for its nutrition. So whenever there is an altered environment around the nucleus, it will develop cataract, and also there is increased oxygen tension after PPV, which causes more oxidative stress, which causes damage to the lens proteins. And most common type of cataract is nuclear sclerosis. If there is a posterior subcapsular cataract, suspect lens touch and posterior capsular dehiscence. Next question. A 40-year-old male patient underwent hyperbaric oxygen therapy for decompression sickness, and he complains of defective vision in both eyes. What might be the cause? Option A, myopia. Option B, acute rise in intraocular pressure. Option C, central retinal artery occlusion. Option D, optic neuropathy. Your time starts now. And the answer is myopia. So eyelid twitching is the most common ocular manifestation. Myopia is reversible. The hyperoxia modifies the protein concentration and local water distribution, which leads to reduction in the backscattered light and optical density, resulting in myopia. In long term, if the patient is exposed, patient may develop cataract due to oxidative stress. Next question. While calculating the IOL power, the difference in axial length between the two eyes is typically not greater than, I repeat, not greater than, option A, 0.1 mm, option B, 0.2 mm, option C, 0.3 mm, option D, 0.4 mm. And your time starts now. And the answer is 0.3 mm. The difference should not be more than 0.3 mm. We have two methods to calculate axial length. One is the ultrasound, another one is the optical. Ultrasound measures the anatomical axial length from the corneal vertex to internal limiting membrane, and optical measures the optical axial length, that is from the corneal vertex to RP. Even 1 millimeter change in the axial length can lead to 2.5 to 3 diopter change in the IOL power, which might cause a refractive surprise. And this change is more in shorter axial length. It can be more than 3 diopters also if the axial length is very small. We will move on to the next question. All are signs of posterior capsular rupture during phacoemulsification except A, sudden deepening or shallowing of the anterior chamber. Option B, momentary pupillary constriction. Option C, sudden deepening. None of the above. Your time starts now. And the answer is none of the above. The signs of PCR, intraoperative signs, are sudden deepening and shallowing of the anterior chamber. Momentary pupillary dilatation or constriction can occur. That is called as the pupillary snap sign. And poor followability of the lens particles. Occlusion bell will be heard without visible phacotip occlusion. This is due to the vitreous blocking the probe, and sudden difficulty in rotating the nucleus or the moving a nuclear fragment because of the presence of the vitreous. Next question. A dispersive ophthalmic viscosurgical device used in phacoemulsification has which of the following properties? Option A, adheres to and protects the endothelium. Option B, easy to remove. Option C, helps in performing capsulorhexis. Option D, prevents collapse of the anterior chamber during high vacuum. And your time starts now. And the answer is, it is dispersive. It disperses and adheres to and protects the endothelium. So there are two types of OBDs we will use. One is the dispersive and cohesive. Dispersive has low viscosity, low molecular weight, and low surface tension. So they can spread and protects the endothelium. Since they are spreading, they cannot maintain a space and they will just coat the endothelium and protects it. And it is very difficult to remove also because they are spreading. But these cohesive viscoelastic substances, they cling to each other and form a space because of their high molecular weight, high viscosity, and high surface tension. They will cling to each other and they can form a space. So they can sit like a blob and can create a space, and they are easy to remove. Once you remove, and everything will come out easily. So this is the end of the first session. Next, we will move on to the next MCQ set by Dr. Tamanesh Basu, who is an ex-consultant of Shankar Netralaya, Kolkata. Current position, he is a consultant at Netralayam Super Speciality Eye Care Center, Kolkata. He is a specialist in glaucoma, cataract, and anterior segment diseases. He has numerous publications in national and international journals and presented multiple papers and posters in several national and state conferences. Over to you, sir.
Thank you so much, Dr. Venipriya. Thank you for the kind introduction. And thank you, Prashant sir and Shilpi ma'am, for including me once again. So, my set of questions. So the first question is, IOL glistening is graded by which system? Option A, Sommering grading. Option B, Elschnick's grading. Option C, Miyata grading. Or option D, Ishihara grading. Your time starts now. Okay. The correct answer is Miyata grading. The IOL glistening is actually a small vacuolated shiny spots over the IOL, and it is graded by the Miyata grading. There are three grades are there, 0, 1, 2, 3. Yeah. Moving to the next question. Yeah. MI loop, me loop is made of, what is the, it's made of a PMMA, or option B, HEMA, option C, nitinol, or option D, sodium hyaluronate. Your time starts now. So the correct answer is nitinol. It's a nickel titanium alloy which is super elastic, and it is used for chopping the nucleus with the loop. Next question, please. So identify the instrument. Your options are option A, Malusian ring, option B, Behex ring, option C, Gupta ring, or option D, Asia pupil expander. Your time starts now. The correct answer is B-hex ring. It's invented by Dr. Shubhen Bhattacharya. So it's the typical B-hex ring. Next question, please. Okay. The nodal point of the eye is situated at option A, posterior surface of the cornea. Option B, at posterior capsule. Option C, midvitreous. Or option D, at RPE level. Your time starts now. Okay. The correct answer is at posterior capsule. The nodal point is a theoretical concept actually, which describes the schematic optics, and it is around 7 mm behind the posterior surface of the cornea. So it's at the posterior capsule. It actually defines the size of the image over the retina. Next question, please. During the phacoemulsification, once the vacuum is built up and because of an occlusion and suddenly it is broken, causing the sudden collapse of the anterior chamber. This particular phenomenon is known as option A, chatter, option B, followability, option C, duty cycle, or option D, surge. Your time starts now. Okay, the correct answer is surge. Hopefully, everyone you got the right answer. Over to the next set of questions. Yeah.
So with this, we end with the first set of MCQs. So now we will start with the unscramble the words by Dr. Vijay. So just to familiarize what we need to do is, this is the sample question for you. So this is one word. So we have scrambled it, you have to unscramble it. So you will get the time for this. So like for this, the answer was unscramble only. So the word unscramble was scrambled and you need to unscramble it. Okay. So with this, I hand over the screen to Dr. Vijay sir.
Thank you. And the first unscramble word is FLATULUCM. Your time starts now. And the answer is?
Madam, do not reveal the answer until I give a go-ahead, doctor.
Okay.
Yeah. Okay. And the answer is?
Yeah, can go.
Okay, sir. Can I?
Yeah, sure.
Okay.
Yes.
It's a multifocal. So all the unscrambled words are related to cataract only. Now let's go to the second question. HIRPASEC. Your time starts now. And the answer is?
Hold on, doctor. I'll just give a go-ahead.
Yeah.
Yes, can go ahead.
And the answer is? Asperic. Let's move on to third question. CRIOTALC. Your time starts now. And the answer is?
Hold on, doctor.
Yep.
Can reveal.
That's no answer is cortical. The fourth question. NEMTCIENUTS. Your time starts now. Can I reveal that?
Just a moment. Yes.
The answer is intumescent. And the final unscramble word, BHODOPHRICY. Your time starts now. Can I reveal now?
Yes.
The answer is hydrophobic. Now, the first 5 unscrambled words are over. Now,
Yes. So now, thank you, sir. So it will be now word one answers. So remember, PGs and everyone, that the answer is only one word. There are no two words. There is no space, no full stop, no comma, nothing else. So you need to write just the answer, one word answer. So if there will be space in between the words or anything, it will be taken as wrong. So let's share the first sample question for this. Like posterior part of eye is called as. Your time starts now. So time is up. So it is retina. Okay, I hope everyone has understood. So with this, we move on to this set of questions. So I request Dr. Tamunash sir.
Yeah. Please.
Yes.
So the thickness of the posterior capsule in microns.
So you need to write only the numerical value. Don't write microns or anything in that. Okay.
Your time starts now.
Hold
So
on.
the-
Yes.
Yes, can go ahead.
So the correct answer is 3.5 micron. Next question, please. What is the type of cataract associated with blunt trauma? Just the name. Your time starts now. Okay. Should I tell?
I think we should wait
Yeah,
for the
go
side.
ahead. Yeah.
Okay. Yeah.
So the cataract is known as rosette cataract. So, okay. Next question, please. So the phenomenon of lens fragment bouncing around the tip is known as just the name of the phenomenon. Your time starts now. Your time starts. Okay, can I tell the answer?
Yes, please.
Okay. The phenomenon is known as chatter. Okay. Next question, please. The cataract is graded with which system? Just the name. Just the name would be enough.
It's short form
Yeah.
also, so you can use that also.
Yeah.
Just write short form. Yeah.
Yeah, the short form. Yeah. Time starts now.
Can display the answer.
Okay. So the correct answer is LOCS or lens observation classification system. Okay. The next question, please.
May. Yeah.
So the wavelength of the femtosecond laser cataract surgery in nanometer used for flax. The wavelength. Your time starts now. Okay. And so the answer is 1053. The answer, please.
Yeah.
It's 1053. Yeah. So these are my 5 questions. Next is
Yes. So now we move on to the second set of unscramble the words. Okay, Dr. Vedi Priya ma'am.
Yes, ma'am. Yeah. Okay, next set of unscrambling the words. The first question. ESMOPIPRKHCAHAOR. And your time starts now. Can I reveal the answer?
Yes, go ahead, man.
And the answer is microspirophakia. And the next question, DYIOSIHSRCOTDNE. And your time starts now. And
Can
the
show the
answer
answer.
is hydrodissection. Next question. Easy one, I think. RL X S C P E S O H R I A Q. And your time starts now. And the answer is, can we repeat?
Yes.
Capsulorhexis. Next question. HKAMRCEAMJ. And your time starts now. And the answer is
Yes.
jackhammer. And then next question. POCESUHDEAECOEL. And your time starts now. And the answer is
Yeah, reveal.
pseudophacosy. So with this, the unscrambling the words gets over.
Yes. So now it's time for the break. So, sir,
So
please.
thank you, Dr. Vanipriya. Wonderful. That was. Now it's time for us to take a small break. Of course, it's a commercial break, and here is a small. Wonderful products this pharma has, which has been doing wonders to us. Thank you once more, His Highness, for helping us out with this program. So now, after this break, let us move on to the next set of MCQs. And the first speaker is, first quiz master is going to be Dr. Vijay.
And the first question in the third round. Yes. The question is, what adjustment in IOL needs to be made if planned in the bag IOL is put in the sulcus? In the bag IOL is put in the sulcus with optic capture of large PCR. Your options are option A, decrease the IOL power. Option B, increase the IOL power. Option C, do not change the IOL power. And option D, leave it aphakic. And your time starts now. And the correct answer is option C, do not change the IOL power. And the reason is, as IOL moves forward, we all know that from back to sulcus, the distance from retina increases and the power of implant decreases. But in this case, it doesn't require because optic is in the bag because of optic capture. The next question is, which of the following will not cause myopic shift in refraction? Will not cause. And your options are uncontrolled hyperglycemia. Option B, nuclear cataract. Option C, long-term hyperbaric oxygen. And option D, choroidal thickening. And your time starts now. And the correct answer is option D, choroidal thickness will not cause myopic shift in refraction. Yeah. And the next question is, The post-operative flat anterior chamber may be due to which of the following? And your options are A. Pupillary block, B. Leaking wound, option C. Choroidal detachment, and option D. All of the above. And your time starts now. And the answer is option D. All the above causes leads to postoperatively flat anterior chamber. Let's move on to the next question. Which of the following is not the cause of increased hazard during cataract extraction in patients with PXF syndrome? And your options are option A, incomplete pupillary dilation, option B, abnormally weak lens zonules, option C, a thickened anterior capsule, and option D, abnormal thin sclera. And your time starts now. And answer is option D, abnormal thin sclera. The thin sclera is not a feature of PXF syndrome. The other features like incomplete pupillary dilation and weak zonules are features of PXF syndrome. Let's move on to the next question. What is the cause of late onset endophthalmitis after cataract surgery? Which is a straight question. And your options are option A, Staphylococcus epidermidis, option B, Pseudomonas, option C, Streptococcus pyogenes, and option D, Propionibacterium acne. And your time starts now. And the correct answer is, I think everybody knows this, Propionibacterium acne is the cause of late onset endophthalmitis after cataract surgery. Let's move on to the next speaker. Dr. Veni Priya, please.
Thank you, sir. We will move on to the next question. So look at the picture. During cataract surgery, the surgeon noted this finding, which is the correct statement regarding this condition. Option A, pseudo-exfoliation can be a risk factor for this condition. Option B, it is seen in 5% of the normal population. Option C, redirecting the capsular rhexis towards the center can help in preventing the complications. Option D, using cohesive viscoelastic substances helps in completing the rhexis. Your time starts now. And the answer is pseudo-exfoliation can be a risk factor for this condition. Explanation. Actually, we see the capsular wrinkling due to zonular dehiscence. It is a sign of zonular dehiscence. Common causes for zonular dehiscence are pseudo-exfoliation, ocular trauma, prior vitrectomy, trap, and high myopia. Other less common causes are Marfan syndrome, Ehlers-Danlos, homocystinuria, hyperlysinemia, and Weil-Marchesani syndrome. The intro of difficulties we face when we are doing surgery in the presence of zonular dehiscence are the capsular rhexis will be difficult due to abnormal vector forces created by the areas of decreased or absent countertraction of zonules, and nucleus rotation and cleavage can be difficult, and cortical cleanup should be done tangentially, not radially. We will move on to the next question. Look at the picture. The picture shows the HPE of cornea. Which statement is true regarding this condition? This is an abnormal picture. Option A, Congo red is the strain of choice. Option B, defective vision will be more common in the morning. Option C, high risk of failure after corneal transplant. Option D, usually bilateral. And your time starts now. And the answer is defective vision will be more in the morning. The diagnosis is it is a bullous keratopathy, probably due to pseudophakic bullous keratopathy. What we see in the anterior part, the upper part is the epithelium, below is the endothelium. You can see bullae underneath the epithelium and an endothelial. There should be a single layer of endothelium. Look at the picture on the right side, and you can see the single layer of endothelium, but the endothelium is scanty on the left side picture, and bullae is seen and intrastromal edema is seen. And bullous keratopathy usually will have early morning defective vision. We will move on to the next question. The risk factor for capsular phimosis syndrome are all except A, young age, B, zonular dehiscence, C, uveitis, D, retinitis pigmentosa. And your time starts now. And the answer is option A, young age. It is usually seen in older age due to the irregular zonular dehiscence. And capsular phimosis or capsular contraction syndrome is due to the fibrosis and contraction of the anterior lens capsule, resulting in the resulting in the distortion IOL displacement. The common causes are small diameter capsulorhexis, zonular weakness, uveitis, pseudoexfoliation, RP, advanced age, diabetes, Behçet syndrome, myotonic muscular dystrophy, and high myopia. We will move on to the next question. Which statement is true regarding endophthalmitis vitrectomy study? Option A, early vitrectomy is beneficial. Option B, intravenous antibiotics is beneficial. Option C, the results cannot be applied for endogenous endophthalmitis. Option D, aqueous is the best source for culture. And your time starts now. And the answer is results cannot be applied for endogenous endophthalmitis. It is particularly done for the post-cataract endophthalmitis. So this result cannot be extrapolated for the other endophthalmitis. Vitrectomy is indicated only when the vision is PL or less than that. If it is more than PL plus, tap and inject antibiotics. There is no role for intravenous antibiotics, and it cannot be applied for other type of endophthalmitis. Next and final question from my side. A 62-year-old male patient who is a known diabetic for the past 10 years underwent right eye phacoemulsification with TCIOL. On POD1, patient has 1/60 vision with severe limbus to limbus corneal edema with 4+ cells. The best investigation recommended is option A, AC tap, option B, vitreous tap, option C, B scan, option D, irrigation fluid analysis. And your time starts now. And the answer is B scan. So this clinical picture will lead to two differential diagnoses. One is toxic anterior segment syndrome and another one is endophthalmitis. The main difference between these two are the involvement of the vitreous that can be done with B scan. And the pathogenesis of TAS is due to chemical reaction to products used in surgery, and endophthalmitis is due to infection. The time of onset is day 1 in TAS. It can be, endophthalmitis can be from 3 to 7 days based upon the virulence of the organisms. Corneal edema, it is very diffuse and limbus to limbus. And endophthalmitis mostly posterior chamber, and it can be focal involvement of the cornea or variable involvement of the cornea. IOP is usually normal in TAS, high in endophthalmitis. Vitritis is usually B scan is normal. Vitritis is not be there, and endophthalmitis, vitreous abscess is always seen with the B scan. Treatment, steroids, there will be a dramatic response, and endophthalmitis, antibiotics is the treatment. Prognosis is usually good with TAS, and it is poor with endophthalmitis. Thank you.
So with
Next,
this,
we
we
move on to the next
yeah.
question.
the last set of MCQ and the last set of today's quiz. So I request Dr. Tamonash sir.
Yeah, please. The first question. What is the refractive power of aphakic eye? Okay, the options are option A plus 60 diopter, option B plus 43 diopter, option C plus 35 diopter, and option D plus 20 diopter. Your time starts now. Okay, the correct answer is plus 20D. For the refractive power for aphakic eye is plus 20 diopter. Next question, please. Okay, postoperative intracameral moxifloxacin we all use, which can cause a very rare but like a specific complication. The options are A, Bates syndrome, bilateral acute iris translumination; B, UGH syndrome or uveitis glaucoma hyphema syndrome; C, UZS syndrome or Uret-Zavalia syndrome; or D, NVG or neovascular glaucoma. Postoperative intracameral moxifloxacin. Your time starts now. Okay. The correct answer is Bates syndrome or BADI or bilateral dilated iris syndrome or bilateral acute iris transillumination syndrome. The cause is unknown, but it can happen. It very rarely can happen with intracameral moxifloxacin. Next question, please. So you have to identify the device shown in the picture. The options are option A, capsular tension ring; option B, Sionis ring; option C, capsular hook; or option D, Ahmed's capsule tension segment. Your time starts now. So the correct answer is Ahmed capsular tension segment. The difference between CTR or CONE is they give us circumferential support, but this Ahmed capsular tension segment, this gives a direct support to the area of zonular dehiscence. Next question, please. Which of the following is not a biometry method? Options are option A, Barrett; option B, Kane; option C, Hofferque; or option D, Jawal. Your time starts now. Okay. The correct answer is Jawal. Barrett, Kane, and Hofferque are different biometry methods for IOL power calculation. Next question, please. So identify the type of IOL. The picture is not there.
Hmm. I'm sorry, it is not displayed here.
Okay. Can we just share the screen somehow or show the picture
I'll,
somehow?
I'll see. I'll see.
It's the last question, final question. So time.
तुषार अपन ये हो गए क्या?
तुषार
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 Yeah. So identify the type of IOL. The picture is here, and the options are option A, piggyback IOL, option B, eat-off IOL, option C, accommodative IOL, or option D, light adjusted lens. Your time starts now. Okay, the correct answer is accommodative IOL. So this type of flanged haptics are there over the optics, and it actually helps to move the lens forward whenever we are looking to the near object, thus increasing the power of the IOL. But this sort of IOL was not very popularized because of the capsular phimosis and capsular fibrosis causing erratic results. That's why this IOL were not very popular. But this is an accommodative type of IOL. Thank you so much. Thank you so much.
Thank you, Tamonash. Wonderful questions. I hope the PGs have enjoyed it. So can I stop sharing the screen now?
Yes.
Yeah. Okay. Can I request all the quiz masters to come online now for a while? Yeah. So postgraduates, how was the quiz? The inaugural session? Was Dr. Venipriya as simple as means as easier for her, or her smile was deceptive for you people? I hope not. I hope not. So Dr. Vijay, Dr. Tamonash, everyone were quite kind to you. The questions were all warming up for you. So quite a basic level of questions which we had asked in this. And I hope it was a good learning for you. I think there is some question on the screen. So with this, I think, Sai, can you hear me? Sai? Yeah. Yeah. So we would be, as much as the postgraduates are interested, we also have a few people who have been following us since last 5-6 episodes. These are the private practitioners who do not fall into the postgraduate category, but they are interested in learning. They are interested in enjoying the fun of quiz, and they do have been participating with us as a private practitioner category. So let us look at how many of them today participated and who are the top 3 people who become eligible for the prize per episode. So Sai, can you share the thing, list of it?
Just a moment, doctor.
Yeah. Do I see any mentors in the people who have joined us on the quiz platform? The mentors are please requested to log in and join us or on this particular Zoom platform. They can get their video on as well as audio on. We would like to have a small chat with you people. We are thankful to you for encouraging your teams, your college students to participate in this quiz. We are always thankful to you, indebted to you. And of course, your interest naturally is absolutely essential for the students to come forward in life and push them and make them winners in this particular situation.
When the mentors can raise their hands so that I can promote them to the
Yeah.
panel.
Yes, mentors, please raise the hand so that we can promote you on the thing and you can join as a guest. We would like to have a small chat with you people. How much time would it take, Sai, for you to compute the results for this?
Less than a couple of minutes, doctor.
So remember, postgraduates, we will be having the second episode of the preliminary rounds on the alternate means next Wednesday. That is going to be 22nd of January, again at 7:30 p.m. That term would be the second round. Remember, there are 5 rounds of preliminary, six rounds of preliminary 6 preliminary rounds, out of which the top 4 performances will be helpful to us for computing your best performance. And the top teams who are going to participate in, who will move into the quarterfinals. So, and the next episode is going to be on cornea and refractive. Today was the cataract was the theme. So next time it is cornea and refractive. So be prepared for that particular theme. And predominantly your questions will be on cornea and refractive. Our quiz masters have been requested to come out with those questions. And thank you, Tamonash, Dr. Vijay, and Dr. Veni Priya for creating wonderful. It was really interesting and quite informative, and I learned a lot again. Somehow,
Thank
as
you so
I'm
much.
doing my hair, I probably feel that.
Sai, can you display? Acha.
Yeah, I'm trying, I'm forgetting the questions, or rather, it is helping me in refreshing my knowledge back of ophthalmology. Thank you. Thank you for that. So be stay with us. Let us see. We will congratulate the private practitioners.
Sai, are you going to share the screen?
Sai, can you share it on the screen, the top 3 private practitioners?
I've just posted on the group, madam. That's fine.
Okay, I will read it out for the thing. So we have 3 people who have, I mean, the top 3 private practitioners have, their number is this 9320308028, and the initials are CHI. Can I request them to just log in? And the mobile number again is 9320308028. The second person who is eligible for the prize is 94011672009. And one of the again winners is going to be 94451430443. So these 3 participants from the private practitioner category are requested to log in onto the Zoom platform. We will be giving you the access to this Zoom platform. We would love to see you online and congratulate you. And of course, your prize money will be shared with you shortly.
And kindly request them to show hands so that we can promote them.
Yes, on the Zoom platform, the numbers which I have shared are the winners of in the private practitioner category. Please raise your hand so that we can upgrade it you to, and you can join us.
Good evening, sir.
Yeah.
Good evening, ma'am.
Yeah.
Sir, I'm Dr. Tanmay Mahapatra.
Okay.
Am I audible, sir?
Yeah. Please.
So nice to meet you again in this platform, sir. And I was one of the winners in private practitioner, sir.
Oh, thank you. Thank you. कहाँ गया यार?
एक minute.
Good evening, sir.
Yeah. So just join us. These are the winners in the private practitioner category. Let me just get you on. So people just go through it. So 2 people from the winner category in the private practitioner have joined. The 3rd person is yet to join. Do join us immediately. Meanwhile, we'll have a chat with the winners for the today's episode in the private practitioner category.
Yeah. Good evening, sir. I'm Dr. Chinmay.
Chinmay, you are not eligible.
No, he
You
is
are,
in the private practitioner category now.
you are not yet cleared. You should have participated as a team. Okay, welcome. So this guy was amongst the top 10 finalists. He's a final year resident. You are yet to clear your DNB finals, I believe.
So theory I cleared. Practical I'm waiting for.
Okay. So this guy is from Nagpur. We are proud of you, Dr. Chinmay. Thank you for again participating. And I would love to see you as a team because you are still eligible to participate.
He is not eligible.
No, because exam will be now, sir. That's why I didn't think I was eligible.
Okay, fine. Congratulations once more. And who is the second one? Who is the other private practitioner? Can I have your name, please?
Sai, please unshare the screen.
Please unshare the screen till we have a chat. So Chinmay was there. Who was the other from the private practitioner category? Dr. Mahapatra, just join us.
I'm Dr. Tanmay Mahapatra, sir.
आपकी इसमें नाम क्यों गलत आ रहा है?
I think there is some error, sir. And
It is coming as Tamonash Basu. I was wondering how can Tamonash Basu, who is a quiz master, again participate with us as a participant.
no, sir,
Okay,
there is something wrong in this.
Yes.
So,
both of you. Okay, no issues. Doctor, where are you, Doctor? Please
sir,
introduce.
I'm in military hospital, Ambala, sir.
Haji.
Sir.
Fauji,
Earlier, I participated last year also, sir. From during that time, I was posted in Wellington, sir.
Okay,
And
Chennai.
now I have been, yes, sir. Now I have been transferred to this place, Ambala.
We are
So,
proud to have you. I know you, but I wanted you to introduce yourself just because our viewers who are viewing the episodes should be
sir,
aware of you. So we are congratulations once more, and I really love your persistence and your happy to your habit of participating and winning the way and stealing away most of the prizes most of the times. It's a
thank you,
applause.
sir. Thank
So
you, sir.
Dr. Venipriya, Dr. Vijay, Dr. Tamonash, you can just grill this major from Army who has participated. How do you look at it? Yep.
Sir, it's a very good learning opportunity, sir. And along with that, also it is very encouraging because I'm continuously participating and I'm seeing the way the questions are asked. They are very beautifully arranged and organized questions, and very logical questions are asked, especially in this platform, sir. So I really like the questions, and it is very beneficial for keep on continuing touch with the studies and all, sir.
So I think this particular compliment, I think will be fattening for Tamonash, Venipriya and Vijay Bhaskar, both three.
Yes, sir,
All the
definitely.
good
They were
Yes,
feedbacks.
sir.
very,
Hmm?
yes, yes.
Thank you.
So how do you feel, Dr. Venipriya? Few more calories
Yes, sir.
added to your
It's nice to have that, like, actually, when forming the question itself, I plan to be like, it should be day to day, they have to think about, like, it should be very practical, not from recall questions. It should be practically relevant, and it should be helpful to them for their practice. And it should be within their range also. It should not be very high-fi, not from the IOL fellowship level. We cannot ask for them. It should be from basic also. So thanks for noting that point, sir. Thank you, sir.
Thank you. And Vijay, Dr. Vijay
So,
Bhaskar, how did you work on it to
yeah,
make
this
it so
actually,
palatable and easy and means appreciable by the viewers
yeah,
and the
thank you first. And first thing is, before going preparing the question itself, first we will read. So what type of question that we should ask. So that is somehow useful for us also, like because most of the time we forget to read after post graduation itself. This type of things, participating in quiz and conducting quiz, both are almost equally same. We have to read a lot.
तमोनाश बाबू मोशाय तो मिस्टेक डाल के ही क्वेश्चन बनाएगा इसलिए सभी को बहुत पसंद आता है क्वेश्चंस
Yes, like this is my second time, so thank you for including me again. And this time also, like the level of the questions are like very good. Like other two, I like the questions were very good, and I got to learn so many things from the questions actually. So that's there, and obviously what Dr. Vijay said, like we also read everything, and we also like thought that this question would be better. So let's put it like some basic questions should be there, and some questions where it will be fun. Like so, that's like that's how it is.
Dr. Tamonash, I would agree with everything, but for one sentence which you have stolen away from my mouth, from my, vocabulary, that is going to be that I learnt a lot. In
Yes,
fact,
sir. Yes, sir. I
is
like
for
other.
That's
people
true.
like me, lazy people like me who do not work on it and just
Yes,
sit
sir.
stuck on learn from you people. So, Pete, I'm just pulling you.
I just want to ask Dr. Tanmay and
Dr. Tanmay.
Yeah.
Yeah.
Sir, how
Yes,
you regarding this unscramble the and the one word, because that was the first time we introduced.
Yeah.
So
How do you
This is-
find it?
Yeah, I found it very difficult actually because initially for the initial part it was very confusing, and later I little bit gained in the speed, and the typing is really we require to type it very fast because I was using a mobile for the Kahoot platform. So the typing should be fast, otherwise the time is very less for typing larger words. And basically, it is not. It is actually very confusing. You cannot guess the word immediately. So it was good one, sir. It was very good.
It was fun. So
Yes.
Chinmay, as a postgraduate, Chinmay, you have left?
Yes.
Okay. Okay, fine. So I think we had a great session today. So now it's for time for us to wind up today's episode number 1. We had a wonderful participation. We had 200 plus teams enrolled right from the very first episode. And all this due credit goes to the quiz masters who really work hard. Dr. Tamunaj, Dr. Veni Priya, Dr. Vijay, we are extremely thankful. The Brain Teaser and the Big Q team is absolutely thankful for this wonderful hard work you have done. No words are enough to thank you. Beat. So we will be meeting again and do pursue with this particular BQ. We will be needing your help as and when we will be requiring in the further episodes next season. We'll be seeking your help and looking forward to that. Meanwhile, just a request
you,
to
sir.
all quiz masters as well as the postgraduates who have joined in, logged in today, to spread a word that episodes has just begun. This season 4 has just begun. So even if you have missed, few of the postgraduates who have missed today's episode are not at a loss. They can definitely play out of the 6 rounds 4 and they can still make it into the quarterfinals. So do share it with your friends, other postgraduates, and that will be a great job for on behalf of us. So thank you, everyone. Thank you, His Highness team. And of course, Sai for wonderfully taking care of the back end work. So till then, now it's time for us to say bye. We will be again meeting on 22nd of January, again at 7:30 p.m. Till then, bye-bye from Team BQ. Thank you. Thank you.
Thank you, sir.
Thank you,
Thank you.
sir.
Thank you, sir.